because it is going to also help you get maybe one or two gifts. Let us see how you will be performing in the quiz section also. So welcome to the CDE program, proudly presented by IDA Bangalore, and the program partner is KD Society's College of Dental Sciences from Bangalore. So this is on the occasion of World Oral Health Day. So let us see some interesting and very important features as we proceed. So Group Pharmaceuticals is the collaborator for today's event. And as you know, we always believe that healthy smiles matter. Well, healthcare professionals as well as the pharmaceutical industry professionals, they are verily two sides of the same coin because both are doing a very important aspect of delivering healthcare. I will illustrate this with a very interesting example, and that is the gripping story of how rapamycin was discovered. Rapamycin is the world's first immunosuppressant. It was the world's first drug that was discovered for use in renal transplant patients, drug-eluting stents, and also this has the property of antifungal, and it is the first cytostatic drug, anti-cancer drug ever discovered. And now today it is trending as an anti-aging molecule. The history of this rapamycin starts in 1964 when Canada sends a group of 40 doctors and scientists to Easter Island. It is also called Rapamui, and they traveled by a ship of the Royal Canadian Navy called Cape Scott. Once they reached there, each individual had his own idea of what to investigate. So there was one scientist, Stanley, and another scientist called Georges, and they had an interesting proposition. They are wondering why the natives in Easter Island never got tetanus, despite the fact that whenever they get hurt and they are moving around barefooted, still they will never suffer from tetanus or tetany rather. So they took 61 soil samples and investigated the soil samples at the University of Montreal for about 3 years, then transferred the soil samples to Ayer's laboratories. This is now taken over by Pfizer. And there, one scientist called Dr. Suren Sehgal, who is an MPharm from Banaras Hindu University and PhD from Bristol University, England, he was investigating the soil sample and he came up with a very important discovery. And that fascinating discovery was that of Streptococcus hygroscopicus. It is a bacterium, as the name indicates, which produces rapamycin. Rapamycin is a macrolide antimicrobial, no doubt, but this multifaceted molecule had antifungal property and became the world's first immunosuppressant drug. And as I had said, this is a cytostatic drug, very useful in colon cancer treatment. And because of its usefulness in the autophagy regulation, autophagy is basically cell eating. You may have heard of that, which got a Japanese scientist his Nobel Prize. He is also responsible for anti-aging or avoiding the cell senescence. So this fascinating discovery was solely because of the academia as well as the industry collaboration. And Dr. Suren Sehgal was in the pharmaceutical industry. More discoveries were to follow. The target of rapamycin, this protein was also discovered within the mammalian molecule. What a fascinating story of industry academia relationship. So what we observe is that the ecosystem always works in research as well as commercialization. And this is where our philosophy also comes, where we are operating in the dental products, which of course is a worldwide growing market. It is around 37 billion US dollars, and the implant treatment segment is also growing fast. Of course, the toothpaste market is the largest by revenue share, and the compounded annual growth rate of the global oral care markets is also growing, which clearly indicates adoption of dental products, oral care products is very high. The 10,000 crore toothpaste market is now seeing more traction for herbal toothpastes as well as the sensitivity toothpastes. Maybe because of the change in lifestyle, sensitivity, discomfort, and pain has become more in dental patients. So Group Pharmaceuticals, which is committed to providing high quality and the best oral care products has got in its DNA very interesting concept of having industry academia relationships. And that is why we were able to produce. We are doing it also, and that is the first time in India products. These names are very familiar to the dentists, and we are doing it so only thanks to the various industry academia relationships that we are having. In fact, we are going to launch one more product from the University of Columbia, which will be launched shortly. The brand name is Ora Life. And all our other brands like Cheyenne and Elsens is because of the Queen Mary University and Imperial College London, with whom we have got a number of relationships. So these sort of partnerships are engaging us to make us produce and offer very exciting and useful products to the dental community. Even with JSS and KLE, we are having a number of running projects, and we hope to see that this continuous improvement will come about with newer product range. So these are some of the products that all dentists are aware of, and we thank them for their patronage, which is being used either during the chairside procedure or before or after the chairside procedure, and even after the dental filling to avoid the post-operative sensitivity, discomfort, and pain. Cheyenne is prescribed. Pediflor is a darling for all the pediatric subjects. And the latest innovation, again with the patented color changing technology, is Densive, which is a denture cleanser tablet. Within 15 minutes, renders the denture stain free and aseptic. So, this world class manufacturing is offered to you from two plants, which is at Tarapur and Malur. We also have the various types of certifications required to make international class products and export to more than 60 countries. So we are partnering dentists to create healthy smiles and laughter. So now comes the interesting session. I request Ms. Rupa to help me. So this is called Dental Rocketry, a fun quiz. So I'll be posing a question, fastest finger first. So we will be giving a gift hamper to the person who is going to give the correct answer first in the chat message. So Rupa will be looking at the chat message, and we will see who will give the first answer to the first question, which is this. The question is, name the key protein of the enamel that helps build a scaffold to support the hydroxyapatite layer. So what is the name of that protein of the enamel, which is 10% of all the enamel proteins, and it helps create a scaffold to support the hydroxyapatite layer? What is the name of that protein? One single word you have to type. Any answers, Rupa?
No,
Dentist,
no,
please.
sir. No, sir.
Dentist, please do type.
No, sir.
Anybody can participate. Please do type the answer. What is the name of that protein in the enamel which helps build a scaffold? It is 10% of all the enamel proteins. I'm looking for the answer. Please do type. Dentist, please recollect your
Ashwini,
knowledge.
Dr. Ashwini, sir.
What she has
Enamelin.
typed?
Dr.
Enamelin.
Ashwini.
Yes. Yes. Thank you, doctor. So Dr. Ashwini is the winner of the first question. So we will send the gift hamper to
Dr.
her.
Ashwini. Okay.
Now I'll go to the second question. So the answer was enamelin, which is the answer to the first question. The second question. Now you see here, husband and wife are quarreling. Now similarly, imagine two teeth are rubbing against each other. Okay, just like husband and wife are both quarreling, two teeth
Dr.
are
Kishore,
rubbing.
sir. Dr. Kishore, HC.
What is the answer, madam?
Attrition. Attrition.
Yes. What is the word that describes this type of sensitivity? It is attrition. Okay. Thank you, Dr. Kishore, sir. So that is the second answer. So it is like the husband and wife both are fighting. If only one person is fighting, then you can say it is abrasion. And if a relationship is broken, you can call it as abfraction. And if there is regurgitation of the chemical, that is the acid reflux and causing erosion of the teeth, so that will be erosion. Four causes of the sensitivity, discomfort, and pain. Now let us see the third and the last question. So I am showing here the most vulnerable area of a tooth for sensitivity pain. The clue is in this diagram. So this is the inverted tooth, and the most vulnerable area is being shown here. You have to tell the name of that vulnerable area. What is that vulnerable area? Please type in the chat section. This is a little tough maybe. The most vulnerable area of a tooth for sensitivity pain as shown in the picture. So refer to this diagram and make a guess. Where is that vulnerable area where exposure of the dentinal tubules occurs? Can I have the answer, please? Please do type in the chat section. So the clue is in this diagram.
The Dr. Sahana. Dr.
What has
Sahana
she
Nayak,
typed?
cement to enamel junction.
Yes, thank you so much for this answer. That is the right answer. So
Doctor.
we have got products also for addressing such sensitivity, discomfort and pain. It is the cemento enamel junction CMJ which is responsible. So congratulations. The three winners for today's round are Dr. Ashwini, Dr. Kishore sir, and also Dr. Sahana madam. So thank you very much. And let us see now the very interesting and the most important aspect. So over to Dr. Prashant sir to take over and provide the welcome address and take the event forwards. You can unmute yourself, Dr. Prashant sir. You are on. The stage is yours. Continue, Dr. Prashant sir.
Yes, yes. Slide PowerPoint.
It's in desktop.
Dr. Prashant sir, any issue
Yes,
there?
sir. Yes, yes, sir. Is it visible, sir? PowerPoint is opening.
No, PowerPoint is not visible. You please, ಅದು arrow ಇದೆ ಅಲ್ವಾ share, you please click on that. ಅದಾಗಿದ್ಮೇಲೆ screen click ಮಾಡಿ. You click on that share. Afterwards, you click on that screen.
Yes, sir. This is the one. Share.
Share ಮಾಡಿಬಿಟ್ಟು screen click ಮಾಡಿ.
Entire screen. Share.
ಈಗ ಸ್ಲೈಡ್ ಶೋಗೆ ಹಾಕಿ.
Okay, sir. This slide show. Okay, sir. Is it audible?
It is audible. Everything is
Yes,
fine,
sir.
sir. Please
So,
continue.
on behalf of IDA Bengaluru branch, I once again welcome our speaker for today, Dr. Kishore sir, Dr. Sunil Chuklakar sir, and all the audience assembled here. Now, I request our president, Dr. Srivastava, to speak a few words on this occasion.
Good afternoon, sir. Good afternoon. Am I audible? Sir? Hello?
Audible, sir. Please continue.
Yeah.
Perfect.
So I take this opportunity, sir, to address the delegates who have logged on to this webinar. I, Dr. P.K. Srivastava, the President of IDA Bangalore branch, on behalf of the IDA, welcome all the delegates attending the webinar. This is a well-designed 5-day webinar to observe Oral Health Month under the auspices of IDA, Ministry of Health, the KSDC Institute of Dental Sciences, Bangalore. With the constant support of the group Pharmaceuticals, this program has been very well designed, which we have got 5 credit points by the KSDC. I also welcome Dr. Kishore for this program, and already we had one more speaker, Dr. Chandrasekhara Janakiraman Raman yesterday, who was the first speaker. I take this opportunity to congratulate Dr. Prashant, the CDE convener, for taking up this Oral Health Month and conducting the CDE activities effectively. The IDA Bangalore branch is conducting numerous CDE and CDH activities. We are also planning to have a dentist convention and cricket by the IDA members. I request everybody to be a part of it and make it a huge success. On behalf of the IDA EC Executive Committee members, I thank everybody. Jai IDA, Jai Hind. Thank you very much.
If you want to share, sir, you have to repeat that. You please go to the share and click on screen.
Yeah.
Share. You come to share. Enter screen. Enter screen.
No.
Enter screen. Now. Okay, sir. Myself, Dr. Prashant BR, CDE convener, would like to just give a gist of the CDE programs conducted from IDA Bengaluru branch. Till now, we have conducted around 5 CDE programs. And to commemorate the World Oral Health Day, as advised from IDA Bengaluru branch and the IDA head office and the Ministry of Health and Family Welfare, we recently conducted on 20th March a program on Insight on Oral Health Day and Prevention of Oral Problems, a pediatric perspective from Dr. Srinivasa. These were some of the photographs of the programs being conducted from Bangalore IDA Bangalore branch. And this is the second webinar which we have been conducting. So yesterday we had got one program on oral diseases and neglected epidemic. So it's a continuous series of 5 webinars. Here the advantage is you're going to get 5 CDE points. It's entirely online and automatic key certificates will be downloaded. And the third webinar is on effect of stress on oral health by Dr. Nagashri. Fourth on oral cancer and potential malignants by Dr. Subhashini. And fifth is the malocclusion and preventive orthodontics, a pediatric perspective by Dr. Ravi Kumar S. So today we have got a program by Dr. Kishore HC, a modern oral hygiene aids. Dr. Kishore, I welcome you. Kishore Hadal is a renowned periodontist from Bangalore, India. He is an alumnus of Krishnadevaraya College of Dental Sciences from Rajiv Gandhi Institute of Health Sciences. He has been a consultant periodontist with over a decade's experience. Dr. Kishore places great emphasis on patient education alongside the treatment aspect. His areas of interest include laser dentistry, periosystemic interrelationship, and integrated dentistry. He has been a postgraduate guide, associate professor, and is a much sought after speaker in the dental circles, having delivered scientific lectures at various forums, including Indian Society of Periodontology, BAP, and Interdental Association. He has conducted various workshops and numerous lectures for Curaprox, Johnson & Johnson, and Colgate. He has over 15 international and national publications to be added to his credit. He is the first ITOP lecturer from India and certified by ITOP Association, Prague, Czech Republic. Currently, he is the head of education, Curaden India, which is a Switzerland-based premium oral care company. Dr. Kishore has served in capacity of Honorary Secretary of Interdental Association, Bangalore chapter. He has also been served as Joint Secretary of Karnataka State Branch, IDA. He was the recipient of the Best Local Branch Secretary Award at the national level. Congratulations to Dr. Kishore, and I once again welcome you for today's presentation. And thanks for accepting our invitation. Dr. Kishore, sir?
Yes, Dr. Prashant.
Yes, sir. Yes, I can proceed with your presentation, sir.
Thank you.
Yes.
Is the screen visible?
Yes, sir. Everything
Yes.
is perfect.
Okay. So first of all, I would like to thank the office bearers of Indian Dental Association who found me worthy enough to address this esteemed gathering. Also, I would like to thank Mr. Sunil Chiplankar sir, who is the Vice President of Group Pharma, for sponsoring this event. So the topic today given to me is called Modern Oral Hygiene Aids. And I would like to begin by telling the only constant is change. And we are all seeing dentistry change by the day. We have seen the rapid digitalization in our impression making, in our X-rays, radiology, etc. And oral hygiene aids is no exception for this. And before I start, I would like to make a small disclaimer. There will be plenty of images coming out from various companies and the oral products. Please don't construe it like as an endorsement of any brand or anything. These are just for representational purposes. With that, I would like to talk. And in today's topic, we would be talking about the history, because unless you know a little bit of the history, we will not appreciate what is the modern things going forward. I'll also touch upon few lesser known facts that nobody speaks about in the dental curriculum. And we'll talk about innovations, both on the technological front, which comprises the large part, and a little bit of chemical innovations, professional and home care innovations in oral hygiene aids, Internet of Things. This is growing rapidly by the day, and almost our whole life is encompassed in IoT. All the apps, the smart devices, what we see belongs to IoT. So how this is affecting our oral hygiene aids, we'll talk about it. Sustainability. Whatever innovations we bring forward, unless it is sustainable, it is not going to be worthy addition to our practice. So we'll talk a little bit of sustainability and then the conclusion. As we all know, dentistry is a technically oriented profession, and the healthcare sector is significantly influenced by this ubiquitous trend of digitalization. As I told earlier, all our radiograph, the image making, the impression making already has grown leaps and bounds in digitalization. And the same phenomenon or the disruptive changes, we are seeing it in our oral hygiene aids also. One of the example what we see is the aligners, how it is a disruptive change for the better in some cases and for the worse in some cases. So disruption is the norm of the game, be it your taxi hailing apps or your oral hygiene. So disruption is going to be present and all prevalent, and we have to be ready for that. That is the whole thing about today's lecture. Some of them might sustain, but most of these disruptive changes will be a pipe dream. They come and they fall by the way. And oral hygiene trends are no different from this. Only the fittest and the sustainable will continue to be in force. Going to the history, since time immemorial, Indians and the Middle Eastern people knew the effects of neem stick, datun, miswak, etc., which were the primitive toothbrushes. But the ancient Chinese were the first who started manufacturing toothbrushes. And William Addis in 1780 was the first. He is from Britain. Actually, he was a jail inmate. There he designed a toothbrush out of necessity. And he started the Addis toothbrushes, and later it became the wisdom toothbrushes. And he was the one who commercially started manufacturing of the toothbrushes, right? And most of the toothbrush bristles belong to animal hair. And you can see two animals there, a boar or a hog on the first picture and a badger on the second picture. Even in the traditional days, the cheaper toothbrushes used to have the animal hair of boar or a hog or a pig, whatever you wish to call it, as the cheaper version of the toothbrushes. And the most expensive toothbrushes belong to the badger hair. And don't be surprised, even today we get badger hair toothbrushes and shaving brushes which are highly expensive. A simple toothbrush with badger hair could cost as much as 18 to 20 euros, that is around 1,800 rupees. So it is still prevalent. And by the way, the picture that you see, a golden toothbrush with ornate engravings, belonged to Napoleon Bonaparte. So this is about 280 years back. So what innovations we are seeing nowadays happen is all in the last 50 years. But prior to that, innovation did happen, but it was at a much slower rate. Coming to the evolution of toothbrush, took a rapid leap once nylon was introduced in 1938. Nylon was a polymer that was discovered in New York and London almost at the same time, hence the name nylon. And after that, almost all the toothbrushes in the world that are manufactured contain these nylon bristles. A very few contained animal hair, which are now almost like exotic things. And 99% of the brushes that you see in the world market today belongs to nylon. But what many dentists don't know is almost all the companies toothbrush that you get in the market today, XYZ or ABC brand of toothbrushes, they use nylon bristles manufactured by a single company called DuPont. DuPont was a French polymer giant. Now it's an American-French collaboration company, and almost all the brushes that you get from every other company belongs to this nylon. Of course, there are few companies which don't use nylon. Some of them use Curaden filaments, which is a patented polymer made up of polyester. The advantage of Curaden over nylon is it is longer lasting. It absorbs less moisture. So this will enable the brush to keep less soggy and reach out all the hard to reach areas without causing any damage to the sensitive areas of the tooth. And these Curaden filaments can be made extremely thin and extremely strong at the same time. So this is a patented polymer made out of polyester. So it is called Curaden. Nowadays, almost all the products that we see in the market, be it a face wash, toothpaste or a toothbrush, the novelty factor is carbon infused or charcoal infused, right? So this is nothing new for us because a lot of our ancestors used charcoal as a tooth powder. However, it was in a crude form and hence excessively abrasion used to take place and the teeth used to get abraded. But nowadays, the processes have improved by leaps and bounds, and hence charcoal or activated charcoal is an active component in most of the toothbrushes and pastes. There are some literature which tells that these carbon infused bristles could help whiten teeth, they could reduce bad breath, and one more main advantage of these carbon infused bristles is the bacterial growth on these bristles is far lesser than your normal nylon bristles, right? But more studies will be needed in future to prove the effectiveness of these charcoal toothbrushes. Now, the moment we hear about carbon or charcoal, many dentists have this apprehension that excessive carbon or excessive charcoal is carcinogenic in nature. Now, it is partly true, but I would not agree completely. Why? Because the carbon that is used in any good toothbrush or good toothpaste is in the activated form. When carbon or charcoal is subjected to high temperature and pressure, it changes its properties, increases the porosity of the bristles, and even in the toothpaste, the surface area increases. So hence, it is found to bind better to the stains and offer greater cleanliness, right? And also during this activation process, most of the polycyclic aromatic compounds which are harmful are negated. So if it's an activated carbon or activated charcoal infused bristle or paste, there is no need to fear for anything regarding the safety. But of course, at the same time, keep an eye on the grit or the abrasiveness of the toothbrush bristles and the toothpastes also, because the bigger the carbon particles in these, it could lead to abrasion. But finely ground carbon particles are actually beneficial. Coming to bamboo brushes, nowadays everybody is wanting to go back to nature, especially the affluent population. They want to go back to the nature and use natural products. So one of the offshoot of this was bamboo brushes. But we have to keep in mind one thing. Even though the brush handles belong to bamboo, 90% of the bristles still manufactured on these bamboo head brushes are from nylon. So you have to dispose of these nylon or plastic ingredients along with the bamboo. Also, bamboo is a natural product and hence absorbs more moisture, and they can be subjected to humidity in your bathrooms, and they can attract or grow more of molds or fungus on the brush handles. So that is one health risk with the bamboo brushes. And replacing all the plastic brushes with the bamboo is not sustainable yet. Why I tell this is bamboo requires a large amount of cultivation area. It is water intensive, and bamboo is an invasive species. So it takes away the plantation area where even other plants have to grow. So technically bamboo is a grass. However, in India, it is classified as a tree. We don't know the reasons why. So recyclable plastic brushes is a viable choice as of now, and bamboo still has a long way to go. Of course, with innovations, probably we can see more of bamboo brushes in the future. In this image, you can appreciate those black mold or fungus that is formed on the bamboo handle. And since it is in the close proximity to the place where we keep it in the oral cavity and brush, it is still not an advisable option. Coming to silver infused bristles. Nowadays, many companies are going back to silver infused bristles. Of course, this is not a new innovation. This has been there for quite some time, more than 50-60 years. But many companies are rediscovering this, and they're going back for the silver infused bristles. Now, why they're going for silver infused bristles is not because of the ornamental value or anything, but silver has been known to be an antimicrobial agent, and it is used even in your medicines, in your anti-infective powders, and even as a laundry detergent. So silver is there, and the nano silver particles. Nano silvers is extremely small silver particles. Once they are embedded into the bristles, they act as an antimicrobial agent, and hence the argument is the bacteria will not grow on the bristles after the use of the brush and it is kept in the bathroom. And many people have this doubt: how are these silver infused bristles manufactured? Whether they paint the bristles with silver, or they are spray painted, or whether they dipped into the silver electrolyte, neither. Actually, it is infused during the melting process. So this infusion happens during the manufacturing process itself, and the particles are embedded into the bristles. So it is like your amalgam, what I would tell. So there is no free particle of silver or any harmful component that is going to leach out into your oral cavity when you are going to brush. So these are extremely safe, no doubt. So here you can see a bristle picture of Tinex. Tinex is nothing but your nylon bristles. Few of the particles are infused into it, be it activated charcoal or your silver or any other chemical. This is how the process happens. So don't think that post your bristle manufacturing it is going to be dipped or coated or anything. It is infused and it is generally safe, most of the products, right? Chewable brushes. Now, the population is very lazy nowadays, most of the younger population, and some of them due to necessity also, they are always on the move. And one viable alternative or modern oral hygiene aid is chewable brushes. Many times this chewable brush doesn't even require water, and these are available in the vending machines. These are extremely popular in Japan, and these comes with flavored bristles where you just take one of these brushes and keep chewing on it. And this is like a disposable brush. So you keep chewing on it, so your teeth becomes clean and it becomes minty or bubblegum flavored. And after chewing for enough, you can just dispose of the toothbrush. These brushes are available for children also, and these tend to be very small but should not be swallowed the brush. So you have to be careful. If you are giving it to your child, you should give one with a bigger handle, right? And some of these chewable toothbrushes come with a plastic ball at the end where you can just rupture it like a pani puri and the paste comes out of it. So you can add it to your brush and begin chewing. The research says that it is almost as effective as conventional brushes. So this is a viable alternative, but it is not so popular in our part of the world. So these are about chewable brushes. Next, coming to the technology, right? Now we keep hearing that ionic brushes. So now what are these ionic brushes? They work on the principle of polarity, where every element in the nature is either positively charged or negatively charged. These ionic toothbrushes are similar to manual toothbrushes in the sense they are not powered brushes where the brush brushes on itself. You have to manually brush, but they are ionically charged. Now, conventional toothbrushes work on friction and force. You apply the friction and apply the force through your hands and the brushing cleans the plaque. However, these ionic brushes, they work on the principle of opposites attract and like poles repel. So similarly charged particles repel and opposites attract. Now teeth, what we have in our oral cavity is negatively charged and the plaque that builds up on this teeth is positively charged. So these ionic brushes release a whole lot of positive ions so that repels the plaque from the hard to reach areas. Conventional friction brushes work very well on the facial lingual surfaces, but these ionic brushes are found to be effective in the inaccessible areas. So these ions, when they are positively charged, they repel the plaque. Now, evidence suggests that ionic brushes are safe to use. They have a good efficacy in plaque cleaning, but it is not worth the cost or the technology because at best it's a viable alternative because your manual toothbrush does the same job as an ionic toothbrush and these ionic brush heads have to be changed at frequent intervals. So this is a novelty. That's why it didn't pick up that much, but still now many bristles, they are telling that we have applied or infused positively charged particles that will help negate the plaque. So still we need to wait on these. Smart brushes, IoT, Internet of Things. These are the things that is very prevalent all over the world, and this Internet of Things has another offshoot called IOMT, that is Internet of Medical Things. We can even name it as IODT or Internet of Dental Things. Here, the interconnection of the devices with the internet, which are embedded into everyday objects, making them to send and receive data. Examples are your Bluetooth headphones, connected cars, smart toothbrushes, etc. Even your fitness bands that you wear, they come under this technology of IoT. So many toothbrushes, what we call smart, are nothing but they are connected to the internet. So they are connected via the Wi-Fi or the Bluetooth, where your toothbrush sends or receives signals from an app or internet, right? So many of this is gimmicks, but few of them have benefits. How they are having benefits is we can be able to streamline oral health care through standardized pressure because there are feedback mechanisms. Some of the products, the apps, the moment you are applying more pressure than required on brushing, it gives you a feedback to your brush, it beeps. Or they can incorporate a countdown timer. So these are the things where we can streamline oral health. There is no way where we dentists can stand in each person's bathroom and monitor the brushing pressure. However, because of these IoT devices, we will be able to streamline oral health care. It also facilitates workflow, that is, repeatable tasks can be performed and automation can lead to efficiency. In the Western countries, we have this hygienist concept where the hygienist takes care of most of your instructions and follow up with the patients, etc. However, in our country, we dentists, however burdened we are, we have to do all that. However, these apps or these workflow facilitation can help us lighten our burden. We can also increase oral health at a fraction of the current conventional cost. Through technology, we can bring down the cost. And one area where this can work is in children or teenagers, because they tend to rebel whatever the instructions we give. However, when technology is involved, they are the first ones to garner that, and it can ignite participatory action, and that can encourage them to probably brush better. But a lot depends upon the usage pattern and the specific advantage offered by the device. So we will not tell just because it is smart or internet enabled toothbrush it is good, or I will not even tell just because it for the same reason it is bad. A lot of success depends upon the person who is using this technology. There is also software to connect with the patients. Suppose you have given them few interdental aids, flossers or toothbrushes, and you want to monitor their condition. And every week the patient is not able to come back to you. So there are certain softwares through apps which the patient can download, and they can even mark the bleeding points where they are having issues, and they can send back the data to the dentist. So the dentist will now know that whether the patient is compliant, how well they are using the technology, or how well they are maintaining their oral hygiene, and what is the troublesome areas when they come back next. So technology is good, but only we should know how to use it and for what extent we have to use it. Ultraviolet and far infrared brushes. So there are near infrared and near UV light brushes. It is a claim. I am not endorsing anything, but claim is that they reduce symptoms of gingivitis, promotes healing, enhances collagen, etc., etc. Right? And they also claim of improvement in probing pocket depth, clinical attachment level, plaque indices, etc. But what we know is light therapy has been useful. We use it even to disinfect our operatories and instruments, and also laser light has been used for various applications. But still, we have to do further research to know the efficacy and safety of this infrared and ultraviolet brushes. But these devices are going to be the future, because whether we prescribe it or not, the marketing budget is so much, and also the funding for these innovative products is so extensive. they will make sure that these products are bombarded to your patients. So it's better that we also know about this, and we are also constantly updating on what is happening on the technological front along with our dental front. Wearable brushes. Not only wearable brushes, you can even see the wearable floss there. This can come in customized models or off the rack, where the patient or the consumer, I will not even tell a patient, they can just wear these toothbrushes and the brush will do the job. Some of these brushes, like this Y brush, they claim that even wearing for 10 seconds is enough, whereas we recommend 2 minutes of brushing twice a day. So these catchy phrases and the new technology are like a bait for the patients, especially the younger population. Imagine a person who is always addicted to his headphone and music in his house can even just put on a toothbrush inside his mouth and can continue doing his work, other works, and within 10 to 30 seconds their teeth are clean. Okay, so this can be based on ultrasonic technology, sonic technology, or through light activated technology, or a combination. Still, again, it is in infancy, but they are making a huge wave, and they are here to stay, the wearable brushes. This is one more device called humoral brushes, where luminous light is given out in your oral cavity. What they claim is this light enters into the areas where your conventional brushes don't, and it kills all the bacteria. This is like a post brushing device. This will not brush, but you can put it to kill more amount of bacteria. Exact efficacy still to be understood. Powered brushes. Of course, nowadays this is a huge market. Everybody and anybody wants to try and use powered brushes. First powered brush was manufactured in 1954 by Proxodent in Switzerland. Next 10 years, it wasn't commercially manufactured at all because cost factor was an issue and it wasn't viable to manufacture at that time. But now, according to the recent surveys, American Dental Association tells 32% of the US adults use a powered brush as their primary method of cleaning. In India, Statista reports this as 16%, but I have my own doubts about it. I don't know what population they surveyed. I would tell that it is in the low single digits. However, it is rapidly increasing because of the cost factor, affordability, and techno-friendly fascination where the younger population have. So we have to know a little bit of the pros and cons of these powered brushes. Now, what are these powered brushes? Anything that runs on a battery is a powered brush. However, not all powered brushes are the same. I would like to throw a little more light on that. There are two kinds of powered brushes that are available in the market. One is the conventional powered brushes that oscillate or rotate. So they are one on the one hand, and the second kind of powered brushes are the ones which uses sonic or hydrosonic technology where the bristles don't rotate but they agitate. The technology is different and the price difference is also huge. The cheaper brushes, which normally function as an oscillating form, they rotate at 6 to 8,000 brush strokes per minute, and these are very cost effective. However, at the same time, they are potentially traumatic. Because of the increased rotation and the harsh bristles, they may cause recession of gingiva and cervical abrasions. But effectiveness wise, some of the studies score this oscillating or counter oscillating brushes slightly better than sonic brushes. These are the sonic brushes. Sonic brushes work at 20 to 42,000 cycles per minute. This is like your ultrasonic scaler. The bristles don't rotate, but they vibrate, they agitate. So what they claim is when this happens, your saliva and your toothpaste swirls and they even are forced into the interdental areas and they clean effectively, right? Few studies put sonic brushes better than oscillating. whereas few studies quote oscillating brushes are better than sonic. But one thing we have to understand, these sonic and hydrosonic brushes are far safer than your cheaper oscillating brushes. That is, we need to know. Safety wise, sonic brushes are here to stay, right? Coming to hybrid brushes. Now, there are all the population where there are 50-50. They want to do manual, they want to do powered. So here is the innovative brushes called hybrid brushes. These brushes work in a combination mode or an individual mode. You can use it like a manual brush, you can use it like a sonic brush, or you can use it like a combination of this. But again, there is no statistical advantage for use of these kind of brushes. But one thing, the choice of these hybrid brushes may increase compliance. The patients might be fascinated to use it because they have the best of both manual and sonic. So these things might hold a success in the future. That is my opinion. So these are other examples of hybrid brushes with the same technology. Both it can work as a manual and a powered brush. Whatever brush you use, right, the technique matters. So here is the efficacy of many of these brushes. What one thing everybody agrees is a modified bars technique is the most effective. So whether you are using a manual toothbrush or a powered brush, use it judicially, apply the right amount of pressure and angulate it properly in all your sulcular areas, and that is going to yield you the best results, right? Coming to oral irrigators, they are extremely popular devices right now, and every other clinic is prescribing or stocking on these products. But just how good are they? So let us take it into the consideration. You can see in the picture there, these brushing or the irrigation tips are angled into the sulcus, and a pulsating jet of water is hitting your teeth and also a little bit of your sulcus, and so it will result in a flushing action. Of course, these irrigators are beneficial, no doubt. They will reduce a little bit of the inflammation, but if you think that they are going to totally remove the biofilm, you are mistaken. You can also see the picture of a waterfalls there. Of course, don't see the girl standing there, see the waterfall. The waterfall is falling from a great height and it keeps hitting the rock day in, day out. But still, if you go and stand near the waterfall, you will find the rocks are slippery. And this slippery layer or the slimy layer is nothing but your biofilm. When 24-hour waterfall falling from a great height cannot remove the biofilm, don't expect oral irrigators to remove your biofilm. However, I am not contradicting it. It is beneficial. It can reduce inflammation. They are especially useful in the region of extensive prosthesis where patient finds it difficult to brush, and a 2017 systematic review found that they were effective much more than a traditional flossing. So what I would like to tell is oral irrigators are not a replacement but a supplement. You should use the conventional devices. Along with that, if you use oral irrigators, it will be like a sonepe suhaga. It will be beneficial. Coated tongue. This is a main cause for halitosis, social stigma. More than 70% of your halitosis is because of coated tongue, and 90% of your bacterial load stems from these coated tongues. Now, tongue is a very sensitive place and you have to clean it very gently. So what I would advise, you can even use this soft rounded bristle toothbrush to brush your tongue post your brushing. So you can brush your tongue as well. However, some people that would not suffice. So you can go for an anatomically contoured tongue cleaner where you have to use it once a day. Just gently run it along the tongue. So this can help you in getting rid of this coated tongue, which is a very prevalent problem, including from children as young as 6 to 10. So you can consider these. Flosses, of course, flosses have their own space and they have their own uses, but all flosses cannot be used everywhere. Where you have wide spacing, you can use a dental tape and you can use floss picks for their easy to handle properties. You have patented expanding dental flosses which you can use in a buttermilk churning motion near the necks of your implant tooth. However, I would advise for the posterior teeth, it is better to use interdental brushes because your floss will not completely fill the embrasure void. Mono-rooted teeth, yes, floss can do a wonderful job, but the poly-rooted or multi-rooted teeth, you still require interdental brushes. Coming to interdental brushes, these form the bulwark in the proximal areas. Your proximal teeth surfaces form 30 to 40% of your surface area of your teeth, and these interdental brushes are the only way to remove the plaque from those tricky areas, and that can solve a whole lot of problems. Rubber tip stimulators. So these rubber tip stimulators have to be used in a back and forth motion in your cervical areas of your teeth and just beneath your sulcus. So how this works is it stimulates the gingiva or the gums. It induces keratinization. It also enhances production of gingival crevicular fluid and ensures flushing action. However, this will work because if you don't use this, many of the patients will start using crude tools like toothpicks and pencils in their oral cavity. So these are a very safe options for a little bit of cleaning and a lot of stimulation of your gingiva to safely use it. Uni-tufted brushes. These are very important tools, especially in crowded teeth, malformed teeth, and also in orthodontic patients. These are a very atraumatic way and cleaning the teeth in a comprehensive manner. So of course, this is time consuming. So prescribe this to your patients who have a challenge in maintaining their oral cavity clean in their challenging dentition, or if they are wearing fixed braces. This is going to work magic in those patients. Of course, everybody can use this, but they should be highly motivated and they should be able to spend the extra 5-10 minutes on their oral care. If they can do it, this is a wonderful tool. And these brushes have taken inspiration from our ancient Indian neem stick and meswak and datuns. So the design is inspired by those tools. What are the future trends? There are going to be app connected toothbrushes with sensors embedded that can map your brushing behavior, and it can also store your brushing data and upload it wirelessly. So on one hand, this can help research. On the other hand, this can also compromise your data safety. Everybody will be able to know or access how long you are brushing, how much you are brushing. And in future, if dental insurance comes into the picture, probably an insurance company with data like this can refuse and tell that you were brushing hard. That's why this has happened. So data security is a real concern, and there are still a lot of gray areas there. Then coming to caries detection toothbrushes. There are some companies which uses laser technology that collects the light reflected from the caries and they detect the caries. However, this is not still commercially available, but already the production has taken place and its experimentation is underway. So this is the kind of technology we are going to see in future. If you think this is too much, I'll just show you a Dental Tribune article next. Shape-shifting nano robots. This is not a sci-fi movie or anything. Researchers have already developed a hands-free micro-robotic system consisting of nanoparticles that will not only brush, floss, but also rinse your teeth. You simply have to pop those devices in your mouth and it will do all the job and it will collect the data. And this is already reality. This is not some sci-fi movie. This is how it works. They are supposed to form hydroxyl radicals in the presence of hydrogen peroxide, which is going to act like a disinfectant and also a mild bleaching agent. So they have magnetic properties which can eliminate dental plaque. So essentially this is a combination of your friction brushes, chemical technology, ionic brushes, everything rolled up into one. And these robots are going to do the job. Not only oral cavity, they are further being tried to disinfect water lines, catheters in urinary infections, etc. So you just drop these nano robots, they will go do all the cleaning process and get away. So these are the kind of technological innovations we are seeing coming into the dentistry. So that was more of technological. On the chemical plaque control, nowadays we are seeing toothpaste with enzymes such as amyloglucosidase, which will break down the plaque matrix and break down the starch component of your plaque. There are anti-caries agents like osteopontin or milk proteins being incorporated into your toothpastes. There is also tea tree oil, epigalactin gallate, which is contain bioactive components. These are being used. So a lot of chemical innovations are also happening. However, it is for another day because these are very extensive and we can't keep going on and on. What I will urge each one of you dentists is you can use this disclosing solution as an excellent oral hygiene aid. I will not tell this is modern or primitive because even though it is primitive, we are not using it extensively. This can contribute for education and motivation of your patient in a big way. All the patients they tell that we brush twice a day, etc. But with the use of these plaque disclosing solution, we can clearly show them where they are going wrong and also show them where they are going right and help them to clean those areas better and also select the right plaque control tool for our patients using these disclosing solutions. So coming to the conclusion, there is no scientific studies that indicate that one specific toothbrush is better to the other. And also powered brushes are superior to their manual counterparts in their ability to remove plaque from proximal areas, whereas facial areas, most of them are the same. And the trauma part, we are yet to determine because even though you are using a powered brush, if you are not using with the right technique or applying more pressure, you will have a lot of problems on your hand. One thing we all have to understand, any manual toothbrush removes only 60 to 62% of your plaque. The remaining 40% has to be removed with other devices like a floss, interdental brush, unitufted brush, etc. Especially in the interdental areas. And whatever chemical plaque control can be manufactured, they are only an adjunct, and mechanical plaque control is the most important way to go. Whatever the innovations happen, the greatest improvement in personal oral hygiene can be derived from the development of motivation and aptitude of the general population. Unless this motivation aptitude is developed, whatever device you might come out or whatever innovations, they are going to be a failure. So I urge the dentists through this forum, educate and motivate your patients and take a little time out to educate them on the tools. With this, I would like to conclude my talk. And at the same time, I would like to thank IDEA office bearers, IDEA head office, all the sponsors, and last but not the least, all of you delegates who have gathered here to listen to this lecture. Thank you very much. Thank you, sir.
Hello, Dr. Kishore sir. Thank you on behalf of IDA Bangalore branch It was an excellent lecture, really inspiring lecture. We came to know a lot of things which we were unaware. We thought
Thank you, sir.
it means we are used to regular mode of oral hygiene, but newer methods which we also need to upgrade before educating the patients, I think. So really, it was an eye-opener presentation. Definitely, our general practitioners and the students have benefited from your lecture.
Thank you, sir. Thank you.
Thank you. So if any doubts or any questions, please post it on the chat box. I request you to please post your questions on chat box. Meanwhile, Dr. Kishore sir, there are a few questions which have been already posted, which I like to bring to your notice.
Yes, sir.
Dr. Rekha Shetty has asked a question. What is a simple procedure to protect our brush from environmental organisms? And how long one should use normal nylon bristle brush?
Okay. Thank you for that. See, very important question. Many people would like to protect their toothbrushes by putting on the brush caps and keeping it in the bathroom, which I would strongly discourage. Why? Because once you put the brush cap, the humidity is trapped in that brush cap and your microorganisms will grow. Your toothbrush bristles need to breathe or aerate. So I would like to ask you to rinse off the excess moisture in your brush and just keep it as it is in the bathroom. The temperature in our country will do the best possible job and it will take away all the moisture. So only thing is shake away the excess moisture. That is one thing I would like to tell. And sterilization is an absolute term. We cannot use the term sterilization for our toothbrushes, and whatever we do, our oral cavity and our environment is filled with bacteria, and there is immune system in our body that will take care of that. So don't worry too much unless the bathroom is in a very dingy place or you're traveling. Keep your brush open, allow it to dry, that will take care of it, right? I hope that answers that. Second part of the question, one of the doctors asked how long you should use a nylon toothbrush.
Right.
The rule of thumb for a nylon toothbrush is you should replace it once in 3 months. If the brush is getting worn away within 7 to 15 days, that means the person is applying too much pressure. Even after 3-4 months, if the brush is not showing signs of fraying, that means they are putting very less pressure. However, I also showed you a picture of a Curaden toothbrush. Those toothbrushes can easily last anywhere between 7 to 8 months. I hope that answers the question.
Okay, sir. One more question from Dr. Rekha Shetty. Will
Yes.
chewable toothbrushes harm the gums? Will chewable toothbrush harm the gums?
First, let me tell you, doctor, I myself have not tried that. But going by literature, what I have found, I will tell you, they should not harm the gums because the material should be such that they are biocompatible and they are designed and they are soft enough so that however efficacy, it is almost same or little less than your conventional brushing, right? Dr. Prashant, I think your voice broke.
Okay, sir.
Dr. Prashant sir, you can continue.
Okay, sir. Next question. Will Ionic and not
Sir,
harm the other negatively charged parts near this around the teeth? Will Ionic?
Sir, your voice is breaking. I couldn't hear the question.
Okay. Is it audible, sir? No?
Yeah, now it's audible. Please tell, sir.
Okay. Will Ionic toothbrushes and other negatively charged parts don't harm around the teeth? When you're going to use our Ionic toothbrush, doesn't harm our sound teeth?
They should not, because what they use is 2 batteries of 1.5 volts. So it's a 3-volt battery that they're going to use. And the energy that is derived from a 3-volt battery is going to be negligible. And already what we know is all our body parts have a charge. Anything in the nature is charged, positive or negative. So only thing you are reversing the charge or changing the charge to repeal the plaque. So I don't think it should harm, and even the data says that they are relatively very safe. So no need to worry about the safety part. Only what we should be concerned is about the efficacy.
Okay. One more question. Is it not harmful to use sonic, ultraviolet or luminary light, etc. used for every day for 2 times?
Yes, I very much agree. That's why when I put that slide, I told the long-term safety data, we have to await results. Okay, because all these days we used to use light as a therapy in certain circumstances and not use it on a day-to-day basis. So the newer claims are coming. So long-term studies are needed. I totally agree with your question. We have to wait for the results. Thank you.
Okay.
Thank you for that question.
Okay, sir. Dr. Suresh Babu sir has asked, regular use of commercial available mouthwashes, are they safe for long-term use? That is what
I will.
clinical. Yes.
I also work for a oral care company. There are a lot of sponsors also oral care companies, but still let me tell you, I put a sentence discreetly. I told chemical plaque control is an adjunct to your mechanical plaque control. Mechanical plaque control is the way to go. As a periodontist, every day I prescribe mouthwashes, but they have specific role and only for specific time. Day-to-day basis, you don't require mouthwashes, especially if they contain alcohol as a solvent. Then they are going to be an irritant for your mucosa. However, I'm not discounting the effect of chemical plaque control, but they have to be used when it's needed, not on a day-to-day basis.
Okay. And one more last question.
Yes,
Which
sir.
is the most economical and safe toothbrush you would advise, and for how long for all the age groups? So
Sir,
this contains for all age groups.
So this question, I would leave the answer to themselves, because one, there will be conflict of interest, one thing, and each one is a perception. See, I will highlight what is required technologically, and this one, choices, when we meet in person, probably we can discuss, but I would like to avoid this question on this forum.
Okay, sir. Okay, sir. So on general note, will toothpaste need to go in hand with toothbrushing? Toothbrushing techniques are also important, along with our oral hygiene aids. What about the toothpastes? Because that's a regular question which being asked by our
Yes.
patients.
I deliver 2 to 3 lectures for different companies on a weekly basis, and I keep telling everybody, toothbrushing is non-negotiable. You have to use it. You can still brush your teeth without your toothpaste and remain plaque-free. But why do we use a toothpaste? Toothpaste have some additional effects, like they might contain enzymes, they might contain freshening agent, they might contain fluoride and hydroxyapatite, they strengthen the teeth. So for all these purposes, we require toothpaste. And even my son, everybody uses toothpaste. But if you are just talking about removal of plaque, you don't require a toothpaste. You can remain plaque free without a toothpaste with brushing. But all the other factors, additional advantages what toothpaste has, we have to take them also into consideration.
Okay, sir. Sir, one more last question which has been just posted now. Or
Yes, sir.
zigzag brushes effective as brushing technique is different?
I will tell you, thank you for this question. I hope somebody asked this. A small compact brush head which can reach into every nook and corner of your oral cavity, good quality bristles, and the right brushing technique. These are the only things that are needed. You don't require any pattern of bristles to give any additional advantage, right? I have few slides where I can show you the disadvantages of each kind of bristle, but today is not the forum for that. Some other day we'll do that.
Definitely, sir. Sure. Okay. So thank you, Dr. Kishore, sir. Your presentation and the questions posted by our audience definitely reach a platform where we can understand better about our oral hygiene aids. And I think this 45 minutes of presentation would be less for us to and for you to speak also. we definitely will call you for another program where we can have a still more bigger presentation.
Thank you, sir.
And
Thank you very much.
Yes,
Thank you very
and
much.
And I request Dr. Kishore sir to please accept this certificate as a token of appreciation from part of IDS and also a part of group pharmaceuticals.
I'm very grateful, sir. I don't consider myself separate from IDS, so I am also part of the family, but thank you for this.
Okay. Thank you, sir.
Thank you, sir.
Thank you. Congratulations.
So, oral hygiene is described as a practice of keeping one's mouth clean and free of diseases and oral health problems. Definitely, this presentation has helped us in reaching this goal and would be a benchmark for our World Oral Day celebrations. So, thank you, sir, speaker, and I thank all the audience, our group pharmaceuticals, Dr. Sunil Chipnakar, sir, for coordinating this program, and I request all the audience to please put your mail address for enabling us to deliver the certificates, and also rejoin us back for an interactive session on Monday webinar where we have got stress and oral health and yoga, how to relate with it. So, okay. So thank you,
Thank
sir.
you. Thank you.
Thank you all.